Greetings, I'm Dr. Jong Chul. When placing implant, crystal approach is most notable in sinus surgery. If there's not a lot of alveolar bone, if the residual alveolar bone height is approximately 4 to 5 millimeters, this approach is used. Today, I'm going to talk about using CAS kit for crystal approach. The method is comparatively simple and patients recover quickly. Both dentists and patients are very satisfied with this approach. I'm going to talk about indication and ways to use the CAS kit, which is most suitable for crystal approach. The contents for today: the general way to do sinus lift, traditional osteotome techniques, limitations, sinus floor elevation with CAS kit technique. These will be discussed. Let me first talk about the sinus floor elevation. If there is lack of alveolar bone, you can do lateral approach or crystal approach to do sinus lift. At times, bone graft may be done as implant is placed. This is done when the residual alveolar bone amount is over 4 millimeters, and as of late, it can be done for when it is over 3 millimeters. In the case of over 4 millimeters, crystal approach is used in general to place the implant, and if it is below that, lateral approach is used to do bone graft for implant placement. Let's look at traditional osteotome technique. In the past, various osteotome tools were used. In the sinus floor, 1 to 2 millimeter underdrilling was done, mallet was used. Osteotome was used for malleting, sinus floor was fractured, and implant was placed. This was done commonly. Because malleting is done to the patient can be traumatized, and this is also a blind technique. Therefore, it can be quite difficult for the surgeon as well. Because mallet is used at times, patient can experience trauma in middle ear, and after surgery, the patient can complain of severe dizziness. It can occur quite frequently. In the case of upper posterior, the amount of residual bone may be different from what is shown on the X-ray and what is actually on the surgical site. Therefore, there can be many difficulties involved with crystal approach using osteotome. The CAS technique which I'm going to mention today is an excellent way to overcome such difficulties. CAS technique is very simple. Indeed so. CAS drill is used to do drilling, check the sinus floor, hydrolift, bone graft, and implant placement. This is composition of CAS kit. There's drilling tool, hydrolift tool, and tools for bone graft. It can be divided into these three categories. Characteristics of CAS drill. CAS drill is used for drilling, and therefore there's barely any damage to the patient. On the other hand, the CAS drill, the tip of it is round. Even if it is contact with the membrane, there's very little possibility of membrane perforation. You can do sinus lift fairly safely. The autogenous bone from the CAS drill can also be used for bone graft. Additionally, Features of CAS drill. There is short drill and long drill. Depending on patient's level of mouth opening or interference of adjacent teeth, you can use it depending on that. The tip of the CAS drill is round and there's cutting edge internally, therefore you can punch it through the sinus floor without damaging the sinus membrane, and sinus lift can be done. In CAS drill, there's stopper which ranges from 2 to 12 millimeter. You can gradually do drilling on the sinus floor for the sinus lift. If you use it well, you can do sinus lift in the most safe way without damaging the sinus membrane, and you can place implant in this way. It's very useful. Ways to use the CAS drill stopper. There's various stoppers from 2 millimeters up to 12 millimeters, and you can gradually drill the sinus floor. Next, there's bone spreader. After bone graft is done, you can spread the bone graft in ideal position in the sinus floor. By doing the spreading very well, ideal bone formation can be made after implant placement. This is a tool for that. CAS drill, when you use this, you do not need additional tools to place the implant. If you want to place 4.5 implant, for soft bone, you can drill up to 3.3. For hard bone, you can drill up to 3.6. And without additional tools, you can place the implant. This is a major benefit. Traits of CAS drill. You can use this for crystal approach, not just for flat sinus floor, but in inclined area and where septa exist without membrane perforation. This is how to use the CAS kit for surgery. Initial drilling is done, CAS drilling is done. After that, using this, you check whether the sinus floor is fully penetrated. You check the sinus membrane. Hydro lift is done, bone graft, and implant is then placed. Crystal approach using CAS kit can be divided into 3. First, you expand to the desired width, and then drilling is done to achieve desired drilling depths. You can also do it the other way around. You drill to the desired depths first and then expand the width. On the other hand, the most widely used way is to do simultaneous expansion of depths and width to place the implant. This is the fastest and most commonly used method clinically. You can choose the first way. You expand to the desired drill width, and then you can determine the depths, or choose the second option. You can drill first and touch the sinus floor first, and then expand the width. The third way is to do this simultaneously, expanding width and depths at the same time. You can use between the 3, depending on your preference. First method, you expand to the desired width and then drill the depths. For example, if the residual alveolar bone is 6 millimeter and I want to place 4.5 implant, guide drill is used, a twist drill is used after that. It is expand to the desired width. The depth is expanded up to 3.1 and 3.6. Sufficient drilling is done to check that the sinus floor has been penetrated. Hydrolift is done and implant is placed. Guided drill and twisted drilling is done. The width is gradually expanded Once you achieve the desired width, you drill to the desired depths, check if the sinus floor is penetrated, do hydrolift, and then place the implant. Second, you first drill to the desired depths, check whether the sinus floor is penetrated, hydrolift, expand the bone width, and place the implant. In other words, guide drilling is done, twist drilling is done afterwards. You advance the depths first and check the sinus floor. Once this is confirmed, do hydrolift, and after that, you expand to the desired bone width. After this, implant is placed. Next is the most frequently used method. Width and depth of the bone are expanded at the same time. Hydrolift is done and implant is placed. In other words, you are advancing as you're expanding bone width and depth using guide drill and twist drill. I believe this is the easiest way to do this. I'm going to give you a brief example of the third method. For example, if the residual bone height is 6 mm and you want to place 4.25 by 10 mm implant, let me tell you how this is done. First, guide drill is used. 2 mm stopper is used frequently and guide drill is done. This is how to mark the implant placement position. Next, under drilling is done about 1 to 2 mm. 2.2 twisted drill is used. The residual bone is 6 mm. So in most cases, a 4 to 5 mm stopper is used and drilling is done. 1 to 2 mm under drilling has been done. If necessary, use stopper and check whether the sinus floor has been penetrated. However, actually, under drilling is done, therefore, it's rare that the sinus floor is penetrated. If you are a beginner and has difficulty in noticing the tactile sense you get when the sinus floor is penetrated, if you use 1 mm longer stopper and check, you can check the sinus floor fairly safely. Next, depending on the surgeon, in 2.8 or 3.1 CAS drill, 5 mm stopper is used and drilling is done. Depending on patient's bone density, it may vary. However, drilling is done slowly, about below 800 RPM. Width expansion is done at the same time, and 6 mm stopper is used in 3.6 CAS drill. When you do drilling, in order to check whether the sinus floor has been penetrated, if you're a beginner, you can use a 6 mm CAS drill. You should use a 7 mm stopper instead of 6 mm. 7 mm stopper is used in depth gauge and check the sinus floor. If the sinus floor is not penetrated, use a 7 mm stopper and drill slowly. Do it below 800 RPM. And if you pay attention to the feeling of the sinus floor being penetrated, in most cases you'll be able to notice that. Check whether the sinus floor has been penetrated, and after that you can do the hydrolift. 3cc syringe is used for hydrolift. Put the saline water and do push in and pull out the saline water as you do hydrolift. Push and then withdraw in turn as you do hydrolift. And if you push too much all of a sudden, the membrane can be perforated, you need to gradually increase the amount as you do the hydrolift. When you withdraw after pushing, if the blood is mixed in the mixture, you can confirm that hydrolift has been done comparatively safely. However, if you withdraw excessively, and if it is excessively fluid, or if there's air, sinus membrane can be perforated, and therefore you need to pay attention. When you do hydrolift using CAS kit, you need to have patience. If you're a beginner, you need to gradually push and pull. Push the saline. At times, hydrolift can be done very easily. In other cases, that may not be the case. In the case of the latter, you need to have patience and push and pull repeatedly, gradually increasing the amount to do the hydrolift. 1.5 to 2 cc was used to slowly push and pull to do the hydrolift. Finally, in the last step, you need to remove the saline and the sinus, and therefore, using full motion, this is removed and implant is placed after bone graft. 3 cc syringe is used. You fill it with saline water. Also, tools for stopping blood are used so that it is held firmly. Push and withdraw is done. If you see a bloody mixture, you can confirm that hydrolift has been done. Finally, always pull to remove the saline and the sinus. You need to do it fully. Bone graft should be done and implant should be placed. In doing bone graft, there's tools for bone graft. There's also syringe type bone, and using that you can do it quite simply. In the case of crestal approach, unlike lateral approach, when we do bone graft, we determine the amount of bone graft and then proceed with the surgery. It's a blind technique. If you put it in excessively, sinus membrane can be perforated. You do sinus lift by 3 to 4 millimeter. You use 0.25 to 0.5 cc, and that should be sufficient. When you place one implant, 0.25 cc is used for bone graft. After bone graft, optionally, if necessary, you can do bone spreading so that bone graft can be positioned in ideal position, and then implant is placed. When you do bone spreading, you need to do it slowly, 30 to 40 RPM. After that, implant is placed. The biggest benefit of crestal approach using CAS kit is that you can do sinus lift easily in inclined sinus floor as well. When you do CAS drilling in sloped area, there may be a case when you are only partially in contact with the sinus floor. If you do drilling excessively, sinus membrane can be perforated. Therefore, in sloped areas, when you use CAS kit for crestal approach, partial contact has been made with the sinus floor. Then you do hydrolift. Sinus membrane will be lifted. Use 1 millimeter longer stopper to advance and drill. Hydrolift is done. Bone graft should be done. Using this method, you'll be able to place implant fairly simply, even in sloped areas. In the case there's septum in sinus floor, you can use CAS kit to do appropriate crestal approach. Septum can be in the area of implant placement, or it can be somewhere in the middle. Septum exists in sinus floor, and if it is not in the area of implant placement. In other words, septum can be very high or low. If it is fairly high, you can just think of it separate, use CAS drill technique that was explained, and do the drilling. Use CAS front and back of the septum and do hydrolift and place the implant. You can place implant in a very simple manner. At times, the septum can be very low. You can do drilling separately. However, if you do drilling in one area and do hydrolift, due to this, the other side of septum can be lifted as shown. Around the septum, you can do CAS drilling and place the implant easily. At times, the septum can be in the implant placement position. In general, the method using osteotome, it becomes very difficult. Because mounting is done, patient can be traumatized. If you use CAS kit appropriately, you can do crystal approach without causing trauma. In the same way, CAS drilling is done. In this case, it can be in partial contact with the sinus floor. If it is in contact with sinus membrane, hydrolift is done. After that, use a stopper that is 1 millimeter longer. Do drilling, grind off the remaining septum. In this way, you'll be able to do sinus lift without membrane perforation fairly easily. Finally, I'm going to talk about doing hydrolift and placing implant after bone graft. This is an example. This is male patient in mid-40s in number 17 as shown. There's septum on the X-ray. In this case, CAS kit can be used to place implant easily. This is 5 years after surgery and it is well maintained. This is male patient in early 50s. In the upper right posterior area, implant will be placed. If you look at the X-ray, the alveolar bone amount remaining is 4 to 5 millimeter and crystal approach seems appropriate for treatment. You can see septum in the middle. In this case, I placed implants on left and right of septum separately. And this was done fairly safely without giving patient trauma. And this is after surgery. This is after final prosthesis delivery. Even after 5 years, this is well maintained. The best way to do crystal approach is to minimize patient trauma and maximizing surgeon's satisfaction. In that respect, if you use CAS kit for crystal approach, you'd be able to do it without sinus membrane perforation in a fairly easy and safe way, and this is an optimized tool for that. Implant treatment has become more common these days, and a lot of interest has been gained regarding sinus lift and implant placement. In that sense, CAS kit technique is really beneficial for all of you. If you master the CAS technique, both patient and surgeons will get more satisfactory results. Thank you for watching.